Acupuncture. Some of us know what it is and might try it, and some of us think needles and immediately stop there. So what exactly is it and what can it help with? The Mayo Clinic defines acupuncture as involving the insertion of extremely thin needles through your skin at strategic points on your body. A key component of traditional Chinese medicine, acupuncture is most commonly used to treat pain. We had a chance to speak with Kendall Burleson, acupuncturist for Baylor Scott White Healthcare in Round Rock, Texas. She explains the risk, some preparations before you go in for treatment, and what acupuncture can be used to treat.
A great thing about acupuncture is that any risk is extremely minimal when you're dealing with a fully trained and licensed acupuncturist. With any procedure that utilizes needles, you have the risk of infection, of very light bruising, very light bleeding. Greater risks that are possible are pneumothorax, which is a punctured lung or another punctured organ. Something like that is only going to happen when the proper precautions are not taken or someone is extremely undertrained.
If you decide that you would like to receive acupuncture and your doctor approves, it's important to find a facility with a staff that is licensed and practices safe standards during treatments.
Whenever a patient is going to receive acupuncture, you always want to make sure that your acupuncturist is licensed by their state board.
Along with the licensed acupuncturist, some other things to look out for are clean, sterile needles. These should be packaged for single use and immediately thrown out once done. Also, make sure the facility is clean and treated at the same level as any medical facility. And if you still have any doubts, ask the acupuncture clinic for credentials to know they can be trusted. Once you decide on a clinic and acupuncturist, there are some things you can do to prepare for the treatment.
The best way to go into, especially your first acupuncture treatment, is to avoid strenuous activity at least a couple hours before. You definitely want to have a small meal at least an hour before so that your body is kind of strong enough to go into this type of treatment. And then it's best to wear comfortable clothing if you can. Ideally, your clothes could be easily rolled up to the elbows and to the knees because most of the acupuncture points we use fall elbow to fingertips and knees to toes. People know acupuncture for pain. Some people know us for infertility, but there is so much more that Chinese medicine can treat than that. Digestive issues, women's health, headaches, of course any type of chronic pain, sleep disorders is a big one, stress, anxiety, depression. We see a lot of those types of patients. For every year you've had the disorder, you can expect a month of treatment. So acute conditions can take anywhere from 2 to 6. Chronic conditions can take 6 to 12, and that's weekly treatments most of the time.
If you're interested in acupuncture or not, it's a good idea to give your healthcare providers a full picture of what you do to manage your health. This will ensure that you get the best care and treatments for you. And just as a reminder, if you do give acupuncture a try, remember to find an acupuncturist that is licensed by the state board in which they practice. For Daily RX News, I'm Gabe Garza.